I just want to thank everybody here at the hospital who is giving me the world-class care that I've received. And I'm happy to say that I just had my 1-year follow-up MRI, and I'm in the clear. I have a clean bill of health, and I wouldn't be here if it wasn't for all those wonderful doctors and surgeons and nurses who provided me with that critical care. So thank you all.
So the mission, vision, and values of an organization are really important. They're really what define the culture and what motivates us and keeps us focused on our primary objectives. Clearly, patients and family-centered care are at the center of everything we do, but from that spins out education and training and research. Quality is a big initiative as well, and it's all about people. We're 5,000 employees and another hundreds of residents and attending staff and learners. So the culture of how we operate, how we care for patients, and how we care for each other is really important.
I think the mission should include the words that are like the art of healthcare. So things like compassion and integrity and respect and dignity and care. So the things that really mean a lot to the patient in their experience of care.
Well, I think as a whole, we are a community of people that feel like I do. They want to be part of a community that cares for people. And that's for, whether that's caring for people back to health, or it's a matter of caring for each other, that we're all in this together.
The number one thing that comes to my mind is healing, right? Whether it's to mend a bone, or to mend a heart, or in our case, in mental health, to mend minds and mend souls, to help people get back to a healthy state of living.
The future mission of KHSC should include words like research, discovery, innovation, excellence, training, and it's not a word but a phrase, best place to work. You know, you can't look after patients well if you don't look after the people that look after the patients with equal attentiveness.
I believe KHSC's values should be rich. And what I mean by that, that's actually an acronym for me, meaning that the values include respect, integrity, compassion, and high performance.
So I think the values and behaviors that should guide us is about being ethical, transparent, making sure that when we make decisions, we're making them not in just the best interest of our tax dollars, but also in the best interest of our patients.
Always respecting patients' individuality. Everybody comes to us with a different set of life experiences.
You should smile and you should be enthusiastic.
Compassion and dignity.
Respect for patients, respect for patients' choices, respect for our staff, respect for each other.
Openness, transparency, honesty, dedication.
Hardworking, trying to be more accountable and more transparent to those individuals on the team and the people that they're trying to look after and teach.
We need to help each other and work together.
Collaboration with patients and families, but also within our teams.
Well, I really feel that compassionate care and concern for the whole person, their body, mind, and spirit, of the lives of those people we touch.
Years from now, I hope that it will be seamless, that care will be seamless. And that's so important for the elderly and the frail and their caregivers.
I think that as a hospital, we can take a leadership role in reaching out to the community and supporting that interconnectedness and really letting people find the right care, right time, right place.
I want KHSC to be a leader in integrating various styles of care, whether it's the ambulatory care of Hotel Dieu or the more continuous long-term care that we find in Providence Care or KGH.
I want KHSC to be a leader in providing really holistic and interdisciplinary healthcare, to really focus on helping the patient as a whole person.
I'd really like to see us as a center that people want to come to work at.
We come to work because it is rewarding, and this is a great place to work, but it's a great place to work because of the community and because of the team. But there's a lot to be done. There are many players and they all need recognition, and it needs to be an enthusiastic, positive atmosphere.
I mean, we need to be facilitating that kind of environment of learning and innovation, again, for the future generations. You know, building those folks up to be able to hopefully stay in Kingston and make KHSC a leader in healthcare.
Exceptional community of medical educators. I think much earlier than 10 to 15 years, I think we can be a phenomenal university hospital partner in how we train physicians within postgraduate medical education.
I mean, I do think we need to play on a national stage. So we're not only a regional treasure, but we need to be a nationally recognized center of excellence. And unfortunately, when it comes to that, that's something other people say about us. If we say it about ourselves, it's irrelevant. We have to have other people saying, that's a great place. I would be happy to go there for my health care.